Hi, my name is Kyle Longton, and I'm the Chief Operating Officer of the American Foreign Service Protective Association. And I want to say thank you for joining us for today's webinar. And we'll be talking about open season activities as well as changes to the Foreign Service Benefit Plan during this open season and going into 2023. If you've not used the On24 platform before, welcome. It is actually very interactive and provides some great options for you to ask questions of me and my colleagues who are helping produce the event in the background. I encourage you to submit your questions using the Q&A feature within the platform. You can do this at any time throughout the presentation. Just simply type your question. It can only be seen by me and the other producers, and we will respond privately, or if we think it would be beneficial for everyone to see the answer, we will post that publicly. There's also a chat feature which you can enable by using the three lines at the top of your control panel there, and there you'll need to put the little check mark by selecting chat, and you can use that as a chat that is public. So I caution you, if there's a very personal question you're asking, to not put that in the chat, but use the Q&A. That is the main place we'll be looking for questions, is in the Q&A feature. But please do that at any time. We'll do our best to answer all of those, and we'll also provide contact information at the end if you'd like to follow up individually. Without any further ado, I am happy to get to the main event, which is our presentation on open season. So let's talk a little bit about where we've been for the last 2.5 years, and for some of us, 3 years, or just up to 3 years, and that is in the midst of a pandemic. And I'm sharing this slide to show you that pandemics are not something necessarily new to humankind. They've been around for millennia, unfortunately. And while the COVID-19 is there in the middle of the second row, with now that number is a little outdated at this point, well over 6 million people have succumbed to it worldwide. It does fit sort of in the middle of things in terms of pandemics that we've seen, even those in our lifetime, with swine flu, HIV, AIDS, and even smallpox in some parts of the world that's been going on for now over 5 centuries. I share this just to show that this is not something new. We've been dealing with this for a long time, and we're still figuring out how to deal with some of these, including the COVID-19 pandemic. But I don't know about you. I am done with COVID, but unfortunately, I don't think it's done with us. You hear some people talking about going back to wearing masks, going back to social distancing, and so forth. And some of those will make sense. And in some parts of the world, they're required. And so what are we seeing in the healthcare environment around the world, but particularly in the United States and in United States healthcare when it comes to COVID and its effect on costs and utilization? We are seeing sort of a COVID hangover. We're seeing more people using healthcare services. There was a time in 2020 where the only healthcare services that people were using were sort of the most expensive and the most intensive when people were coming down with COVID. Other surgeries that were considered elective and so forth, even just regular doctor's appointments, a lot of those were canceled, and with good reason, and for our safety. We've also seen increased utilization of testing and vaccines and boosters, all of which, again, money well spent and advisable for everyone to look at getting those vaccines and boosters. But those come at a cost, and the government's been covering some of the costs for a time, but now health insurance is starting to kick in and pay for not just the ingredients, but also the administration and the ingredients both when it comes to vaccines and boosters. We've also seen people, because we weren't going to doctor's appointments in 2020 and even to an extent into 2021, that we're now going back to the doctor, and we're finding out that maybe we weren't our healthiest during that time. We're finding that people didn't have cancer screenings for a year or two, and now we are finding cancer, but we're not finding it at stage 1. We're finding stage 2, stage 3, even in some cases stage 4. And there are treatment options in many cases, but oftentimes they may be more intensive and more expensive. So there are new costs coming with that. Many of us may have developed prediabetes or diabetes during that time, and that can also be expensive to treat. It can also be intensive on the individual. The same thing with musculoskeletal issues. A lot of us were working from home or may still be working from home. And a lot of us have found that, sitting in our dining room chair or on the couch or reclining in bed to do our work maybe wasn't the best for our back or our neck or our knees. And so we saw a huge explosion in musculoskeletal needs during the pandemic, and it's ongoing. Last year, we saw that utilization of minute clinics or those convenient care settings was up over 300%. We're also seeing throughout 2021 and now throughout 2022, people returning to pre-COVID rates of elective surgeries. And we say elective surgery mean things like a joint replacement so that you can walk without too much pain, and other procedures. Also just going back to the doctor, some return to the emergency room. We're also seeing that the mental health crisis, which, believe it or not, was happening before the pandemic, has not gotten any better during the pandemic, and it's affecting all ages, from the youngest among us to the oldest. Isolation doesn't help. Not learning those social skills for our youngest doesn't help, and it really is affecting everybody, and there are struggles every day. So we're seeing this, and we're seeing people seeking treatment, and I'm glad to say that, but there's increased utilization of those services across the board, and all of that is leading to higher costs in healthcare. General inflation isn't helping either when it comes to other factors. General population health is where we're looking at, more people with diabetes, more people with high blood pressure and so forth, and seeking medications and other treatments to manage those conditions, which is fantastic. If you are facing one of those conditions, absolutely engage in some sort of management program and stick to your medication, but those all come at a cost. We're also seeing, speaking of medications, specialty drugs. There was a time where specialty drugs accounted for a very small portion of what health plans were spending on prescription drugs. Those days are in the past. We are finding that, well over 60% of prescription spend for any health plan, particularly those in the federal program, that's where I've got the data, well over 60% of drug spend is on specialty medications that maybe around 10% of the population are taking. And the average cost of these specialty drugs is $20,000 per patient. And that adds up quickly. These are fantastic therapies that are in some cases curing or at least offering treatment for conditions that previously had no viable treatment, but they do come at a high cost. The other thing that comes at a high cost, and which isn't fully upon us yet, is gene and cell therapies. You may have heard about these and terms like CRISPR and so forth going around. And again, these are fantastic treatments. In many cases, we're seeing cures for things that we didn't think could even be treated. But that does come also at a cost. This is just a snapshot of the current pipeline, some of those, the projections of what was going to be approved at certain times and what we're looking at for this year and even into next year. And we're seeing, as I said, cures, not just an ongoing treatment, but cures for conditions that didn't even really have a management program before. And also some of these have to be done annually. They're not just one-time treatments. And there may be small numbers of people who are facing these conditions, but they come at a high cost. This is just a snapshot of some of these conditions. When looking at something like bladder cancer or even prostate cancer, you're looking at annual treatments, $300,000 for each of those per year. When you're looking at some of these other conditions for hemophilia, sickle cell disease, et cetera, you're looking at one-time infusions. And when I say one time, I don't mean just once, but you get one shot at it in many cases. So you'll see plans are looking at this. They're looking at ways to manage this and sending people to institutes of excellence and so forth to make sure they're getting the best possible chance at success for this one-time treatment. And I'm sharing all of this to lay some groundwork about some things we're going to be talking about later in terms of new management programs and some changes in premiums that you'll be seeing next year. But I just share this because these are some of the changes we're seeing broadly in the medical landscape, but also that are affecting the way that insurance companies are trying to support their members and the conditions the members are facing. Now, I promise this is not all about medical changes and a look back at COVID and a look ahead at innovations. We are talking about federal benefits open season. We are in the middle of it right now. It started on November 14th and it continues through December 12th. And this is your opportunity to make changes to your health insurance through the Federal Employee Health Benefits Program, FEHB, to your dental and vision insurance through the Federal Employee Dental and Vision Insurance Program, or sometimes people refer to it by its website name, BeneFeds, and also for active employees to your flexible spending accounts through the FSAFEDS program. Now, we're going to talk about each of those in turn, but I want to pause for just a moment and mention two programs, insurance programs that are not part of open season. The first is the Federal Long-Term Care Insurance Program. And this is the program, like it says in its name, that offers an insurance plan for long-term care needs. This is available for application for current employees, annuitants, their spouses, their children, even their parents and their parents-in-law. This is a broad program, but it does require medical underwriting after the employee's first 60 days of employment and at any time for any of those other eligible family members. So you can learn more about that program at ltcfeds.com. I will mention that they will actually be closing new applications and applications for changes to your benefits on December 19th, and that they're predicting that will be a 2-year change. So if you're interested in learning more about that, you can continue to learn more, but visit that website. And I'll talk more about long-term care insurance a little bit later as well. The other program that isn't part of open season is the Federal Employee Group Life Insurance Program, or FEGLI. You probably signed up for this on your very first day of employment and may not have thought about it since. Take a look at opm.gov/life to learn more about that program. There's a lot of different options within it. But if you're looking at your life insurance needs, take a look there, but also look at other programs that are out there. You may find something that better meets your needs through either AFSPA or another group. All right, so I'm going to spend most of the time talking about the Federal Employee Health Benefits Program, your health insurance. You have 271 plan choices within the program. I should say there are 271 plan choices because most of those are HMOs that offer coverage only in a specific geographic region. There are 18 fee-for-service plans that will offer some sort of nationwide and global coverage. It's just making sure you understand what those are. And now there are also 37 high-deductible health plan options and 28 consumer-directed health plan options within the program. Now, there are only 2 high-deductible and 2 consumer-directed plans that offer nationwide coverage. So make sure you understand what those options are and how they function. All right, I promised you that I was using those first few slides to lay the groundwork for something, and that is partially to lay the groundwork for this average enrollee premium increase. Across those 271 plan choices, the average employee increase will go up 8.7%. So it is keeping pace with inflation in the United States. I mentioned we're seeing higher utilization of outpatient services and facilities. We're seeing increased utilization of professional services, so just going to see the doctor or having services performed by a doctor, and increased utilization and the increased unit cost of specialty drugs. So just keep all of that in mind and take a look at how your plan is handling all of those programs and the benefits and any changes. I will mention that you can take your Federal Employee Health Benefits Program coverage into retirement. And when you're in retirement, there's some things to keep in mind. Some of the plans offer Part B incentives, so they may waive the deductible, they may waive cost sharing. Some may also offer a health reimbursement arrangement if you're enrolled in Part B. And some are now offering within the Federal Employee Health Benefits Program, within their plan, they're offering a Medicare Advantage option. There are 7 plans that are doing that now. I'll talk more about that toward the end of the presentation, but and sometimes within those Medicare Advantage options, there are also reductions in the Part B premiums, but these are different than the commercial Medicare Advantage options that you see probably advertised on TV or that you may get flyers about every day if you're of Medicare eligibility age. These are federal plans. And again, I'll talk more about that later, but they are at least as good as and as rich in benefits as the plan with which they're paired within the federal program. For those of you who are not in retirement yet, keep a couple things in mind. To take your FEHB coverage into retirement, There's something called the 5-year rule, and that means that you must be enrolled in the FEHB program. You can switch plans within that, but you got to be enrolled in the program for at least 5 years immediately preceding retirement. If you have TRICARE and you've always had TRICARE and that's worked for you, but you'd like to have FEHB in retirement, good news, your TRICARE enrollment counts toward that 5-year requirement, but you must be enrolled in an FEHB program when you retire. So if TRICARE has been working and retirement's on the horizon in 2023, this is the open season to enroll in an FEHB plan. I'll also mention that in retirement, you still retain some open season rights and have qualifying life events, so you are not locked into the plan that you have when you retire. You can still change that. Do check, though, there are some plans like the Foreign Service Benefit Plan that are considered closed plans. And with FSBP, you must have been enrolled while an active employee to select it in retirement, or the only exception to that is if you retire under a foreign service retirement program. All right, let's talk about some of the initiatives that OPM has asked all the plans to look at for their 2023 benefits and programs. They're focused on health equity, and this is looking specifically at things like maternal health and maternal outcomes, gender affirming care, and obesity. And with a particular focus on obesity in children and young adults, that may mean special programs for children and young adults or programs for parents who are helping children who are managing obesity. The program continues to offer comprehensive benefits regardless of what plan you enroll in. If you choose a plan in the FEHB program, it's a good plan. It's offering comprehensive benefits. And for 2023, that means there will still be some coverage for COVID-19 countermeasures, be that vaccines or new treatments that may come out in the future. Look for that. Your plan may be making changes as new options emerge. There's also continues to be comprehensive coverage for treatment and support for those with mental health and substance use disorder needs. So check that out in any plan brochure. Don't hesitate to contact your plan to ask about what support is available. And for the first time, OPM opened the door for plans to offer coverage for infertility treatment and support. And some plans have offered some discount programs. They may be offering more advisory programs. But there are 4 plans in the program that are offering coverage for assisted reproductive therapies, those procedures like IVF. They're offering those for the first time. I'm very proud to say that Foreign Service Benefit Plan is one of those plans, and I'll talk more about that a little bit later. And finally, access to care is incredibly important, and most of us, I venture to say, have had some sort of telehealth or telemedicine visit in the last 2.5 years, maybe for the first time for many of us. And providing coverage for those is an important aspect for the access to care. So is making sure people are accessing preventive services, including cancer screenings. And you'll see plans promoting those preventive services and encouraging you to take advantage of them, as well as offering programs to support those who are facing chronic conditions, whatever that may be. And in a lot of ways, plans are trying to bring that healthcare closer to you whenever you need it. And that may be smart healthcare devices. And I'm not just talking about, an Apple Watch or an app that goes along with it. I'm talking about connected devices, for instance, a Bluetooth enabled blood pressure monitor, or could be something to monitor congestive heart failure, kidney function, or diabetes, a cellular enabled glucometer to help you keep track of that every day. And a lot of those come with a coaching program. So it's not just the technology, it is a human coach, a human connection along with that technology. There are also in-home programs for things like virtual exercise and physical therapy programs, and infusions for those who require infusion medications. When you're talking about telehealth or telemedicine, this can be used for primary care needs, for meetings with specialists, even for behavioral, mental, and emotional health. That's really where we see over 60% of the utilization for telehealth and telemedicine is for behavioral, mental, and emotional needs. And also check out the overseas access if that's important to you. Some plans have coverage when you're outside the United States, some don't. So make sure you take a look at the fine language there and contact the plan if you have a question about that. I've been trying to get back on track. I've been trying for 2 years more, and it's not always the easiest thing, but there are a lot of options available to help us. You know, get a sense of where you are. Do that biometric screening and find out what is your A1C, what is your blood pressure, what are the other factors that come out there, triglycerides, cholesterol, et cetera. Take advantage of the programs you have, things like the lifestyle and condition coaching, or even just digital online coaching, behavioral and emotional and mental health support programs. Some of those have a person on the other end, and some of them are just self-guided programs that you can turn to for daily affirmations or to walk you through some calming measures. Take a look at those. And then, if you're facing a major diagnosis or a chronic condition or chronic pain, something like that, reach out to your plan. Find out if they have care management programs or even pain management programs. Like I said, take stock of your health. Do that health risk assessment that plans offer. Get your biometric screening done as part of an annual physical, and then do something about the results you get and do something for yourself. Maybe it's a coaching program to find out how to sleep more than 4 hours a night. Maybe it's a nutrition program to start eating more than just one vegetable per week. I'm not speaking from experience, but do something, do something like that. Take stock, but also invest some time and some energy in yourself to getting back on track and getting healthy and staying healthy. All right, if you are overseas, and many of you who are watching, that may be you, make sure that whatever plan you have understands the overseas environment. How do they handle payment when it comes to the plan allowance? Are they accepting what the provider bills, or are they reducing it to some sort of fee schedule from the US? How do they handle translations and exchange rates? And do they require that you submit the ICD-10 and CPT codes when you send it in? Because your overseas provider doesn't use CPT codes, and they're unlikely to add an ICD-10 code either. When it comes to service, find out if you've got the option to submit your claims online. That's a real time saver, and it's there. Also, can you get reimbursed, I should say, directly into your bank account through electronic funds transfer? Pretty much all the plans now offer some sort of online customer service tools, including mobile apps that allow you to track your claims and payment status, as well as take part in some of those wellness programs. Finally, going back and forth with email or anything like that can be effective sometimes, but there may be an occasion where you really want to talk through something with somebody. Will they return an overseas phone call at a mutually convenient time? So check that out. The whole thing, though, it's finding the right pieces that work for you, putting the puzzle together for you and your family. And what lies at the heart of that is really how you use healthcare. It's easy to look at the premium and find out how much is going to be coming out of your biweekly paycheck or your monthly annuity, but also look at the total package. Do you want to be limited to in-network providers? Some of the networks are huge, and that may be adequate for you, but do you want the option of going out of network? What about your prescription drugs? Do you have access to the drugs that you need? Can they be delivered overseas? Can they be delivered to your home if you want that, whether it's overseas or stateside? Think about that plan allowance, particularly if you're overseas, and look at the deductibles and copays. Sometimes you may have a plan that's costs less in premium, but it turns out there's a higher deductible or higher copays or coinsurance every time you see a doctor or get a prescription. If you're overseas in particular, think about pre-certification requirements. It's not just for hospital stays anymore. And think about the hassle factor, those convenience pieces I talked about in a previous slide. And finally, I hear from people, hey, I'm pretty healthy. I don't use much healthcare. I'm just going to take whatever is the least expensive in premium. That's one approach. But look at the total package. Also look at the wellness programs that plans offer. There can be opportunities to earn money towards your out-of-pocket medical, dental, and vision expenses. Check plan details, but you can do that just by doing some of the things you're already doing for your health, like getting your annual physical or participating in certain wellness or prevention programs. So check that out. Don't leave money on the table there. I want to take just a moment to talk about a couple important tidbits that everybody should be considering. We talked last year, and you've probably seen articles or heard things about the No Surprise Billing Act that was part of the Consolidated Appropriations Act. This did a lot to protect people for using out-of-network providers at an in-network facility. That's where the protection is. It's when you go and are receiving care at an in-network hospital or surgical center and you encounter an out-of-network provider, someone like an emergency room provider, a pathologist, an anesthesiologist, a hospitalist or intensivist, people who may only come in for a few minutes to your room and you don't even realize it. They may bill you and they may not participate in the network despite the fact that the hospital does. So this protects you there. It's behind the scenes. The most that the provider in that case can bill you is the plan's in-network cost sharing amount. The takeaway here, there are two. One, if you get one of these bills from a time when you were inpatient or at a surgical center, call your plan. They have mechanisms to negotiate this with the provider. It can even result in what's known as baseball arbitration and so forth. But the second takeaway is that this does not cover all providers. Yes, it's when you're in network at an in-network hospital or surgical center, also covers you for emergency services and emergency air ambulance charges. But if you just decide to go see an out-of-network doctor or physical therapist or the cardiologist, whoever it is, that doesn't count. That's not in that in-network hospital surgical center situation or an emergency situation. So that does not protect you when you just decide to go to an out-of-network provider. The other tidbit I want you to think about is the HIPAA 3 or HIPAA authorization form. This form is required. We are bound by HIPAA and follow-up legislation that we can't share anything with you that you haven't authorized us to share. There's limited information we can share even with your spouse or other family members, even if they're on your same policy. We have limits. So I encourage you to fill out this form. Make sure you put the information on file. It typically does have to be renewed every year, but go to your plan's website or contact them, ask for this form. So if you want your spouse or child or best friend or whoever to be able to call and get information on your behalf, make sure that's on file. If you have a power of attorney that specifically mentions medical or healthcare needs, then put that on file. That usually lasts longer than the HIPAA form. All right. So I'm going to move on then to the Federal Employee Dental and Vision Insurance Program and start with the dental program. Now, this is not a contract renewal year for the FEDVIP program, so you still have 23 plans and options that offer nationwide and regional coverage. There's been some changes for 2023, including that the waiting periods for orthodontic services have been removed. And most of these FEDVIP carriers provide coverage for teledentistry services. And most of them continue to pay 100% with no deductible for preventive care. But when you get into higher classes of care, even things just like filling for a cavity, bridge work, crowns, root canals, etc., even all the way up to orthodontia and implants, you're going to see that the plans pay less and you pay more. These are supplemental plans. And the reimbursement can range from 80% to 20%. Check and find out if they have in-network and out-of-network benefits and choose what makes the most sense for you. All these plans are considered voluntary, and that's insurance speak for you pay 100% of the premium. Now, the premium does come out of your paycheck pre-tax, so there's some benefit there, but there is no government contribution. If you're overseas and receiving your care overseas, please note that the premiums and benefits do vary when you're overseas, and there are reasonable and customary limits that apply. Now, for 2023, the premium is only going up 0.21%. So that's almost unheard of with insurance plans these days. So take a look. If you like what you've got, no need to make a change, but take a look at the options. For the vision program, you still have 10 plans and options. All of them have dollar limits on exams, frames, lenses, etc. Some require that you stay in network. Others do let you go out of network, but none of them have network providers outside the United States. Again, you're paying 100% of the premium. And again, check what the overseas benefits are. You're likely to be reimbursed on an overseas out-of-network fee schedule, excuse me. And here again, the average premium is actually going down by 0.41%. That almost never happens. So check that out and see if there's a plan that makes sense for you and anyone you might be covering. To make changes to enroll or terminate your coverage for dental or vision, you want to go to benefeds.com. That is the only place you can make these changes, or by calling the number that's on the slide I'm showing right now. There's no enrollment through your FEHB. It's only through Benefeds. I should also mention that with both the your health insurance, your dental and vision insurance, with all three of those. If you like what you've got and you want to keep the same thing next year, you don't need to take any action. Your enrollment will automatically roll over to next year for the health, dental, and vision. However, I'm going to encourage you to consider alternative programs for your dental and vision needs. The FEDVIP plans are supplemental, as I mentioned before, and they are intended to cover, routine dental and vision services not covered by your health insurance. You may find that other groups, AFSPA or others, have plans that may offer more flexibility or better coverage in certain ways. Maybe if you're outside, we have an international plan, things like that. Check those out. Find what works best for you. The FEDVIP programs have limited qualifying life events to make changes, so you may find greater flexibility outside of the FEDVIP program. All of them are going to be supplemental plans, so you're going to have out-of-pocket costs with any of these plans. The question is just how much. There are also what are known as dental and vision discount programs. These are limited to the United States only, and it's an excellent alternative for those who maybe don't want to pay the premium for insurance, but they want to have some sort of protection. I say it's not insurance, but it's some sort of assurance. It offers discounted prices on dental, vision, and LASIK services, typically packaged together. And these are based on fee schedules. So you know what you're going to pay when you walk in the door. There's no limit on usage. So if you want to get your teeth cleaned 4 times a year, go for it. You know exactly how much you're going to pay each time. The other thing, and I'm a longtime advocate of hearing health, is if hearing aids are something you need or somebody in your life needs, take a look at them. There are sponsored programs out there. Again, they typically work with a US-based network of hearing professionals, audiologists, and others. And they offer the latest technology. You get discounts. The average savings now is over $3,400. You can then submit that to your health insurance, check your health insurance benefits. You may have coverage that will leave you with really reduce your out-of-pocket costs. I am on my 3rd pair of hearing aids personally. They changed my life when I first got them. They keep getting better. So if you or someone in your life is struggling with hearing health, please take that step. Contact a hearing discount program or a hearing professional. Take that step. All right. The last program I really want to talk about before I dig into a few other things outside of the open season changes is the flexible spending accounts program, the FSAFEDS. Now, this program differs from the other two in that it will not roll over. You must take action on this program every year to make your election. So what is this? These are programs available only to active employees, and that's because of a requirement under the, IRS. And these are accounts where you elect a certain amount of money to come out of your paycheck pre-tax. It's a tax benefit for expenses you know you're likely to incur anyway. So there's healthcare FSAs, and you can use that money that comes out for things like your co-insurance or copay, dental and vision needs, and even certain over-the-counter items. The healthcare FSA, in 2023, you can elect up to $3,050. There's still a minimum of $100. If your spouse is eligible for their own healthcare FSA, your spouse also can elect up to that maximum. So going from 2022 into 2023, you must file your expenses by the end of April 2023. You can carry over up to $570 from 2022 into 2023. And going from 2023 into 2024, you can carry over up to $610. But you will forfeit anything left in that account if you do not re-enroll. So take action. If you got any money left in there, take action to make sure that you can carry over that amount. If you have anything over that amount, please make sure that you don't lose anything, and think about the best way to do that. If you're enrolled in a high deductible health plan, you can utilize this program for what's known as a limited expense healthcare flexible spending account, or a LEX HCFSA. This is only if you have a high deductible health plan with a health savings account. In that case, your out-of-pocket medical expenses would come out of that health savings account, and your dental and vision expenses would come out of this flexible spending account. So you only want to elect as much money as you feel like you need for out-of-pocket dental and vision care. Finally, there's the dependent care flexible spending account. This is a household maximum of $5,000. It's typically used for expenses related to care for children up to age 13. There's some other uses for it. I encourage you to go to the FSAFEDS.com website. They've got some great information there, cost estimators and so forth. And that's also where you would re-enroll each year or enroll for the first time. But again, I want to caution you, make sure you don't put too much in there that you're not going to use it and you might lose it. Take action every year to re-enroll so that you don't lose any money left in that account. I promised you that I would come back to long-term care, and here we are. So long-term care refers to care in a nursing home or in an assisted living facility or even home care. And it can cost for care in a facility. I think the nationwide average is somewhere between $6,000 and $7,000 per month. And it's really putting a strain on resources. Some people are paying for this care, whether it's at home or in a facility, through their personal savings. Others have run through their savings and they have turned to Medicaid to cover facility costs. And still others are staying at home and relying on family members to provide care. And often those family members may have their own issues that they're managing, medical or otherwise, or they may be working full-time caring for children and then also putting in time to care for an aging loved one or someone who needs long-term care. But it's really putting a strain on our human and financial resources as a country. Considering the strain on Medicaid, some states are taking action, and Washington State was the first to create a new requirement to have long-term care insurance, either personally or through your employer, or to pay a long-term care payroll tax. Now, this tax goes into effect in Washington State on July 1st, 2023, and it'll be 58 cents on every $100 earned. And the idea here is that it will create a fund, and from that fund, the state will be able to provide minimal benefits for residents who need long-term care. Grand total of $100 per day for 365 days. That's not going to cover everything somebody needs, but it may be a start for some people, but it was also meant to sort of get people thinking about long-term care insurance policies. Washington State's not alone. There are 17 other states considering similar legislation. I put this to you, particularly if you're an active employee, to consider your options. Look at long-term care. It is something that many of us are going to need, whether we want to admit that or not. Many of us will need this at some point. Take a look at LTC Feds. There's some great educational information on that website. You can apply through 11:59 p.m. on December 18th, according to their website right now, but they are taking that application down on December 19th. I also encourage you to talk to a long-term care consultant, or what are known as long-term care professionals. They can sit with you, go through what your resources are, what your needs are, what your wants are, and find you a plan that matches your needs. There's a lot of variety out there in this marketplace. So as you know, our goal is to be a partner in your health, and this takes sort of a comprehensive approach. We offer coaching programs, nurse and social worker support, even expert support for serious diagnoses, and the wellness programs. And I'll talk more about those in just a moment. We've also been focused quite a bit in the last 2.5 years at this point on mental wellness with programs like Able To and My Strength, but also offering those accessible solutions, bringing healthcare closer to you through partnerships with groups like Livongo, telehealth solutions through Teladoc and vHealth, and even pharmacist supports through Express Scripts. We also offer a number of ancillary support programs for things like dental, life, disability, and you may not realize, but financial wellness as well. Partnerships for long-term care consulting and retirement planning and online tools to help you with financial management and financial wellness. So I would encourage you to take a look at all that we offer, but most of what I'm going to focus on today is our foreign service benefit plan. So continuing into 2023, the deductible remains low. We're not changing that. It's $300 for the self-only, $600 for family enrollment. We're also not making any changes to the coinsurance or prescription copays. We're not making any changes to the generous alternative benefits for chiropractor, acupuncture, and massage therapy. You get up to 50 visits. Everybody covered under the plan gets 50 chiropractic, 50 acupuncture, and 50 massage therapy benefits. Each year, we reimburse up to $60 per visit. We continue to expand our direct billing arrangements with our overseas providers as a convenience for our members who are receiving their care outside the United States. And also, when you're overseas, we maintain our sensible plan allowance of accepting what the provider bills as that plan allowance and processing the claims based on that. Now, we are making some changes for next year. I'm excited that we will be having some enhanced maternity support services, including coverage of licensed doula services up to $1,200 per year. And we're enhancing our healthy pregnancy program to include a fertility advocate and new opportunities to earn incentives for communicating with our care managers. We are also, as I mentioned earlier, offering for the first time coverage for assisted reproductive technology procedures. Coverage is up to $5,000 per person per calendar year. It does require prior approval, regardless of where you're receiving those services, in the US or overseas. And when you're in the US, we do require that you go to one of the Institutes of Excellence infertility providers. More information in the brochure or by giving us a call. We'll be happy to share that information. But we are very happy to be offering what is a limited benefit, but to be offering it for the first time. And also for the first time, we'll be offering a Medicare Advantage plan under the Foreign Service Benefit Plan. Now, this plan is totally voluntary. It does include a Medicare Part B premium reduction, and it also has benefit enhancements like silver sneakers. So I'll come back to the Medicare Advantage plan in just a moment, but I promised you more information about wellness programs. And here's the Foreign Service Benefit Plan's simple steps to living well together. Each person, I should say adult, age 18 and older, covered by the plan can earn up to $400 in incentives every single year just by doing things like taking a health risk assessment. 20 minutes answering a survey online, you get $75. By the way, there's still time to do that this year in 2022 to earn that $75 this year. Do it again next year, earn $75 again. Getting your biometric screening, your annual physical can earn you up to $100, and then taking part in a number of other options, cancer screenings, prenatal wellness, like I mentioned before, lifestyle and condition coaching, or even our digital coach programs, and condition-specific actions for managing things like prediabetes, diabetes, high blood pressure, and so forth. So there are a wealth of options out there. I encourage everybody to take a look, find something that works for you. Even just tracking your physical activity can earn you up to $100. So take a look. Don't leave any of that $400 on the table. And our theme for 2022 and continuing into 2023 is that physical health leads to better mental wellness, and it's a link to better you. We will be continuing to focus on things like our healthy pregnancy program and our wellness simple steps to living well together program. We'll also be featuring information about the lifestyle and condition coaching program, with which hundreds of people have had success so far this year. You're going to hear from us about the importance of preventive care and screenings, and the importance of quality nutrition, sleep, and exercise, and how to make use of our member engagement platform. We'll also be sharing information about other programs such as Hinge Health, which is our partnership for home physical therapy and in-home exercise therapy programs. So look for more information about that. Don't hesitate to contact us if you have questions about any of these programs. I told you that premiums across the program were going up 8.7%. The FSBP premium is going up 7% next year. And you can see the premiums there on this slide. And it is not a mistake. Self and family will cost you less than Self Plus One. If you're just a two-party family, I encourage you to make sure you're enrolled in Self and Family. There's no requirement that you have to enroll in Self Plus One. So make that change if you need to Self and Family and save yourself some money. It's an actuarial and fluke and how it works with the OPM contributions, where they contribute just a little bit more to the family than Self Plus One, which means it saves you money to be enrolled in family. Now, I promised you also more information about the Medicare Advantage plan. So this is a new plan that is designed for Foreign Service Benefit Plan retirees who have Medicare Part A and Part B. The official name is the Foreign Service Benefit Plan Aetna Medicare Advantage Plan. So we are partnering with our long-term partners at Aetna, and we are keeping some things in place, like it's the same $0 cost sharing for deductibles, co-payments, and co-insurance that you have today. Now, you can enroll to get enhanced benefits at an affordable price with no extra cost to you. So this is the same premium that you would be paying for your foreign service benefit plan. There's no additional cost. You're paying for Part B, and you still have your portion of the foreign service benefit plan. But what do you get because of that? You have up to $900 per year for Medicare Part B premium reduction for eligible members. That breaks out to $75 per month. You also have added programs such as Silver Sneakers and Healthy Home Visits. Prescription copays can be as little as $0 for generics from preferred pharmacies and as little as $2 from standard pharmacies. There are unlimited chiropractic, physical, occupational, and speech therapy visits, and enhanced acupuncture and podiatry care. This is a plan that offers nationwide providers, so you can use any provider who is eligible to receive Medicare payment and accepts the plan. It also includes some things that we don't have under the Foreign Service Benefit Plan or really any of the FEHB plans, like routine vision exams. So, you might not need that supplemental plan because you've got some additional coverage here. And there's some additional programs that are being offered with this plan. You're familiar with Teladoc as a virtual telehealth option already available through the Foreign Service Benefit Plan. You continue to have that under the FSBP Aetna Medicare Advantage plan. Also, hearing aid reimbursement. The hearing aid reimbursement under the Medicare Advantage plan is the same as it is under Foreign Service Benefit Plan, which is to say $4,000, up to $4,000 every 3 years. I want to talk about some of these other programs, though. Through Resources for Living, members can find help to locate the resources needed in daily life. With just one call, a life consultant can help with things like finding contractors to do work around the house, researching senior housing and adult daycare, gathering lists of activities at local senior centers, and even assisting in other needs. Now, that's not to say that the insurance is going to pay for those things. We'll just provide somebody who can help you locate those things and know who to call or where to go. The non-emergency transport program ensures that retirees can make it to and from their doctor or hospital appointments safely without having to rely on family or friends. At no extra cost, the plan provides 24 one-way trips of up to 60 miles of the starting point. If you find yourself inpatient in the hospital when you are discharged, this plan offers a meal benefit program through a relationship with GA Foods. The program offers home-delivered meals at no additional costs, 14 pre-cooked meals, and that's 2 per day for 7 days following your release from inpatient care. And finally, one of the most requested programs that I have heard in my almost 10 years with Foreign Service Benefit Plan, there were a drum roll would be happening right now, Silver Sneakers. This is an overall wellness program that may help members improve their health to live the life they love. The program gives members access to exercise equipment, classes, and social activities at thousands of locations nationwide. And because it's 2022, Silver Sneakers also offers live and on-demand classes, which is especially useful now, and that's through a virtual format where you can log in yourself from home or wherever you may be to take advantage of that. So if you're one of the people who's contacted me about Silver Sneakers, it's finally available. We can't make it available under the regular Foreign Service Benefit Plan. We can make it available under the Medicare Advantage Plan, and so here it is. Now, I do want to point out some important differences between the Foreign Service Benefit Plan and the FSBP Aetna Medicare Advantage Plan. So some services require prior authorization. This includes inpatient hospital, outpatient surgery, no changes really there. Physical and massage therapy. And there's one of the other big differences is the massage therapy benefits. So under the Medicare Advantage Plan, massage must be deemed medically necessary. There's a third-party group that completes a medical necessity review after your provider completes a review form. Now, you can go with a provider through the ASH network, which is the group that does some of the review, or an out-of-network provider, but whatever provider you use for massage therapy services must accept both Medicare and the Aetna Medicare Advantage Plan. There is no coverage for massage for comfort or relaxation purposes. The pharmacy benefits under the Medicare Advantage Plan are through CVS Health. So this is not through Express Scripts. Take a look I'll give you a website in just a minute. Take a look at the formulary list. You can check the list of in-network pharmacies and so forth. Make sure that this works for you. It is not an automatic transfer. You will have to request a new prescription from your provider, But this may, with those lower copays, and it may be the right choice for you. So take a look at that. Should also mention that customer service is no longer handled by AFSPA staff members. It will be handled by an Aetna Retiree Service Center. These are people who've been trained for specifically for this plan. They've been through specific CMS training. So that is where that will happen. And I should note that CMS rules apply. There is limited ability on the part of Foreign Service Benefit Plan and AFSPA to get involved in any decisions or coverage decisions and so forth. This is the plan that's been approved by CMS, and the benefits are as they're stated. So I share that. I also want to mention that overseas coverage, I don't have it here on the slide, but this is intended for people. You must be a resident of the United States to opt into this plan. And it's also intended for people who are receiving the majority of their care in the United States. There is coverage for urgent and emergent needs, something like a medical emergency or an accidental injury. If you're traveling for a brief time outside the United States, this is not intended for someone who's receiving, the majority of their care outside the United States. This is a flexible plan, so you can opt into this or opt out at any time. It's completely voluntary, and you can opt in or opt out outside of open season. So if you opt in now, you decide come March or April that it's not right for you, you can move back to the traditional Foreign Service Benefit Plan that you have experienced for years on end. If you start hearing good things about it come March or April from people who opted into it, and you decide you want to try it out, you can make the call at that time, and we can get you signed up for the Medicare Advantage plan. How do you do that? Go to fsbphealth.com/retiree. There you'll find information and enrollment links, an online provider directory, frequently asked questions, the prescription formulary. And then to actually opt into the program, you can call the number on your screen, or you can go to aetnaretireehealth.com/FSBP. You will have to register on that site separately, but it should walk you through the process from there. So a quick review. For open season, you have a choice of plans for your FEHB, for your health insurance. The program offers a lot of flexibility, but what it really comes down to is how do you use healthcare? For your dental and vision through FEDVIP, you've got a choice of plans. They're all supplemental. They all will mean that you have out-of-pocket expenses, but do the math. Does it make sense to enroll in one of these plans? Or maybe it makes more sense to put some money in the flexible spending accounts. You can use them for your deductibles, copays, coinsurance, medical, dental, or vision needs, all 213D eligible medical expenses. And don't forget about the dependent care FSA if that applies to you. You have until December 12th to make your changes. How do you make the changes? Well, for active employees, you're going to go through your employee's online HR system, or you're going to submit an SF 2809. Your agency should have issued guidance about what they require. Retired foreign service, you'll want to contact HRSC. You may have received a form with a annuitant newsletter, or you may want to email hrsc@state.gov, call the number there on your screen, or mail that completed 2809 to the address there in Charleston. For retired civil service, you're going to go through the OPM Intuitive website you see on your screen there, or give them a call, or you may want to mail that completed 2809 to the address listed there in Lawrence, Kansas. For FEDVIP, your dental and vision, you're going to want to go through the BeneFeds website or call the number for BeneFeds. I recommend the website. It's fairly easy to use, as is the website for FSAFEDS.com. That is very easy to use. And please remember, with flexible spending accounts, you must re-enroll every single year. It does not automatically carry over. And with that, I want to share with you my contact information. You can even just scan the QR code there for more information. You can contact me with your questions. Please do it soon and don't hesitate to follow up. I know time is ticking for the end of open season. And I want to say thank you for joining me today. For more information about open season, you go to afspa.org/open season.